For a manual release of your pelvic floor at home, first we can do some release on those more superficial pelvic floor muscles, so layer 1 and 2 muscles. What this is gonna look like is, if this is your vaginal opening, either use an index finger or your thumb, whatever like angle feels most appropriate and easy for you at home. We're sweeping from about 1 o'clock to 5 o'clock, and then from 7 o'clock to 11 o'clock. As you sweep through those areas, if you run into something that feels tight to your finger or you feel like achy, painful, reproduces your symptoms, I want you to hold that pressure. Find that spot, hold that pressure for 1 or 2 minutes. You should start to feel that tissue loosen, meaning the pain lessens. Once that starts to lessen, then you can move to your next spot. So then just move, from 7 o'clock to 8 o'clock, move a little bit. If you find another tender spot, hold it again for 1 to 2 minutes. So that's how we're doing layer 1 and 2, especially with painful penetration. Then for those deeper layers, so there's muscles all the way from 12 o'clock to 6 o'clock, 6 o'clock to 12 o'clock again. At 12 o'clock is going to be your urethra. At 6 o'clock is going to be your rectum. So those are areas that we're avoiding. For the most part, we're going to get the most real estate of muscle that's going to be tight from 3 o'clock to 6 o'clock, 5:30, 6:30 to 9 o'clock. So you can either use a wand, if I want you to use a wand, or if you have a wand at home, I can send you a link to one, whatever, that's an option. I think it's easier to use a thumb when doing it at home. So you would use your right thumb to do your left side, your left thumb to do your right side. When doing this at home, you're laying on your back, knees supported. You can even be propped up at like a 30-degree angle to reach better. Use your thumb, find that tight spot, hold for 1 to 2 minutes until that tight spot starts to loosen. Use your breath, breathe into that area, relax your body. Once that one spot loosens, move a little bit, find your next tight spot. Also, this muscle that goes right past the vaginal opening, if you can just like hook your thumb around it and kind of pull down and stretch that way, that's the easiest way to get that muscle, that puborectalis muscle.